Hi everyone, Dr. Brooke Kolisiak here from Legacy Physical Therapy. We have been having a common conversation with our patients this week about the transition to menopause. So I thought I would come in today and talk a little bit more about it with you guys. So many women are unaware of what some of the symptoms are when they make that perimenopausal transition. So perimenopause for many women happens earlier than you think. It can happen in their 30s, in the 40s. So that's a lot earlier than many people think it's going to happen. So you might want to start thinking about these symptoms a little bit earlier on. If you're like, oh, I don't have to worry about that stuff until I'm 50 or 60, your timing may be a little bit off. So what are some things to think about with perimenopause? So it is that transitional time frame where your cycle is ending and you're transitioning to menopause, and that marks the end of the reproductive years. And it starts at different ages. Like I said, you may notice signs such as menstrual irregularity as early as in your early to mid 30s. Many women experience it in their 40s. But let's talk a little bit more about some of the hormonal changes that happen and what those symptoms might be that you might experience with those hormone changes. So when we enter perimenopause, our testosterone levels start to go down, and that usually occurs around age 35. And so some of the signs that our testosterone levels are going down are that we start to have muscle weakness, we start to have fatigue, low libido, sexual dissatisfaction, and vaginal dryness. So these are all 5 biggies, and this isn't even the main hormone that most people think about when transitioning into menopause. So that is the testosterone decline plays a big role in some of the symptoms that we experience when we transition to menopause. Progesterone levels, one of the other major reproductive hormones, also start to decline, usually a little bit later, usually around age 40 or so. Signs of progesterone decline are breast tenderness, irregular periods with spotting happening in between, again, vaginal dryness, potentially mood changes, mood swings, depression, anxiety. So now we're layering on many different systems that are getting affected by it. And so we've learned that testosterone decreases and progesterone levels decrease. And then another thing that decreases, and the main one that people think about as it relates to menopause, is estrogen levels, because estrogen is the main female hormone, and they do decrease over time. And eventually this does result in menopause, which is the actual definition of it is a lack of menses for 12 consecutive months. So just so you have the definition out there, but the reduction in estrogen levels definitely weakens our pelvic floor, okay? And that can contribute to increased risks of pelvic floor issues like pelvic organ prolapse, bladder leakage. Prolapse can happen with the uterus, the bladder, the rectum, so we can start to have a drop or heaviness or a bulge in the vaginal canal. Feelings of fullness, pressure. It can even cause bladder leakage or difficulty issues, bowel issues, low back pain, and pelvic pain. And so these hormone changes are something that we can't necessarily avoid, but something to be aware of so that you can start thinking about how to protect yourself and have your body in a good place as you transition into menopause. So perimenopause is a really good time to check in with a pelvic floor physical therapist because of the changes that can be happening in the pelvic area to make sure that your pelvic floor muscles are functioning and working the way that they should be, so that you don't deal with issues of pelvic organ prolapse or bladder leakage or bowel issues. As the saying goes, an ounce of prevention is worth a pound of cure. So we want to try and prevent things from going on ahead of time. So being proactive and making sure that your muscles are doing what they should be doing can really save you from potentially more complications and issues later on, such as needing to have surgery for different pelvic conditions. So if we really kind of come at it up front and deal with it early, you may be able to avoid having to go down a more serious route with pelvic conditions. So really as if you're noticing some of these symptoms that we talked about that happen with perimenopause, but because of the decline in testosterone, the decline in progesterone, the decline in estrogen, this is a great time to check in with your healthcare provider and to partner with the pelvic physical therapist to make sure that things are working the way that they should be, even if you're not experiencing issues, so that you line yourself up to not have problems down the road. Because we see many, many women who are doing fine in their 30s, 40s, even into their 50s. And then once they've hit menopause for a couple of years, then they start to notice some issues. And like it just started, and in actuality, it hadn't. It kind of started earlier on. And so we want to make sure that we are addressing these issues as they come up so that we don't end up with a bigger problem down the road. So that's the information I had for you guys today. I wanted just to come in and talk briefly about the symptoms of perimenopause. If you have questions, drop them below. If you have other topics that you want me to talk about, drop them in the comments. I'm happy to answer them. But I look forward to talking with you guys again soon. Have a great day.